keto diet, just to tell you what you were just saying, if you go on a keto diet, you will lose weight short term, but that's not healthy because keto diet will jack up your LDL, expose you to heart disease, heart plaque ruptures, and it actually will kill you more. So
welcome, everyone. We have Dr. Aajay Shah with us today. Dr. Shah is a cardiologist out of Oaklawn Hospital in Michigan. That's about an hour or so west of Detroit, maybe. Not sure.
Correct. That's correct. Yeah.
Exactly. Dr. Shah, maybe you can talk a little bit about kind of what your background is, and maybe just to give you context for everyone else, heart disease is the #1 killer. It's the biggest impact on longevity. So we're going to always be coming back to things like heart disease is really important to all of our longevity discussions. So thank you for joining us today.
Of course. Yeah. Thank you for having me. Again, I'm Dr. Aajay Shah. I work in Michigan. I've been in this country for about 34, 35 years. I'm a board certified cardiologist for last 25 years. 3 years back, matter of fact, I got board certified into lifestyle medicine. We'll talk about it more. I practiced a lot of preventative cardiology for the last 25 years, but first 22 years, a lot of my prevention was done with the help of medications and procedures. And I realized that these medications and procedures are actually just putting a Band-Aid on the real problem. It typically is just delaying the inevitable heart attacks and strokes, but it's not reversing it, it's not preventing it. And I realized after taking this lifestyle course that the prevention and reversal of heart disease is just not possible. It's been done for last almost 30 years. In 1991, Lynn Ornish actually proved that with simple lifestyle changes, which we'll talk about it, you can actually, matter of fact, reverse the heart plaques done by angiogram of the heart. So you can actually see the reversal of the plaque. So I've been pretty much big proponent for last 3 years about lifestyle changes. In my patients now, first thing I reach out is for healthy eating, exercise, sleep, other issues with lifestyle, much more than before reaching out for a medicine. And I've seen some major dramatic change. Obviously, lifestyle practice, lifestyle changes involves physician and patient both. When we practice traditional allopathic medicine, most of the control is in physician's hand. Physician sees you, diagnoses you, give you medications. You just, as a patient, passively take the medicine, go home and hope that medication will work and you will do fine. Medication typically doesn't make you feel better. Well, when I prescribe the lifestyle changes for last 3 years, not only patient becomes the active participant, but whatever they do actually not just reverse their original problem, but actually it makes them feel better. It improves their sleep, it improves their mood. So I have actually much more faith into lifestyle changes now, much more bigger impact on a patient's lives than even just prescribing a medicine. So I'm a big proponent of lifestyle medicine. I myself have been becoming whole food plant-based person. I exercise every day. I sleep 7 hours every night. You know, I typically try to walk my talk and I try to become a role model as much as possible. But to be honest with you, 3 to 5 years back, just like many cardiologists in this country, I wasn't a great role model. I myself was overweight. I did not exercise. My sleep was poor. Stress was high. But since I changed into this lifestyle philosophy, I myself have benefited most actually. And this benefits I'm trying to spread to all the people, not just my patients, all the people I come in contact with. We have set up this Facebook page. We have about 7,600 followers. I post every day. And my main mission now is to make as many people healthy as possible with lifestyle changes.
Wow. It's and I would comment on, and I've commented this before, every doctor that I've encountered who goes through lifestyle medicine, they're changed as a result. They typically are frustrated with, the medications aren't working as well as they'd like, and they're starting to get the message of there's a more powerful medication out there in the form of food for several of our common diseases. And I'm sure you feel now you have far more power in your hands to be able to help than you did before this. Is that right?
Definitely. I think the way I take it is that physicians many times don't reach out for this lifestyle medicine practice because number one, we don't get typically training to practice lifestyle medicine until recently. Like for example, in my medical school training, my residency in America, my fellowship in Boston, I got less than 10 hours of training on nutrition, less than 10 hours. And I got probably 10,000 hours of cardiology training, but 10 hours of nutrition. I did not get any training on sleep, did not get much training on physical activity or exercise. So a lot of physicians are not trained to recommend or practice themselves. A lot of physicians, unfortunately, don't have time. For example, writing a cholesterol medicine takes me 1 second, but it takes 20 minutes to help somebody to eat healthy. Same way, many physicians themselves are not doing it, so they themselves don't feel up to, just like in 40s and 50s, the physician who smoked could not tell their patients that quit smoking because they themselves were smoking. Same way, many physicians themselves are not following the lifestyle they should be, and they are obviously subconsciously guilty enough that they are not prescribing. The fourth factor, which is in my opinion a major system factor, is that we don't get paid. We don't get paid to talk about lifestyle changes or nutrition. Matter of fact, if I see a patient for 15 minutes, unless patient is having major issue, I don't get paid. If there is no diagnosis, I don't get paid. Fortunately, now lately, there are new codes available for lifestyle changes. So many physicians like me are starting to branch out to practice lifestyle medicine, and we're getting paid now. And to be honest with you, many physicians, when they see a patient, they just don't have adequate time in this busy practice to recommend lifestyle medicine, because lifestyle medicine is a bigger time commitment than just prescribing a medicine or doing a procedure. So for all this variety of reasons, many physicians are turned off. Fortunately, it's changing. A lot of physicians I see in my WhatsApp group and my Facebook personal group of physicians who are in lifestyle medicine. Actually, I see many younger physicians are starting to go into lifestyle medicine. We will have eventually a fellowship in lifestyle medicine, and one day lifestyle medicine will be, in my opinion, a mainstream specialty, just like cardiology is. And I think when that day happens, healthcare costs will go down. A lot of disease reversal will happen, a lot of disease prevention will happen, and obviously people will live longer and happier and healthier.
Yeah, it's I see the same thing, and I would suggest the two places I see lifestyle medicine having the biggest impact are in cardiology and at primary care.
Yes.
Because primary care physicians have been frustrated for years, right? They're not specialists, and all they can do is write a script or write a referral.
Yes.
This now gives them I think a tool set that's where you got to be on the front line to be able to help patients with this, right?
Yes, definitely. I think as a physician, particularly as a primary care physician, you almost like start to enjoy talking to people about lifestyle medicine because there's more joy into being holistic. I think physicians many times have become robots of pharmaceutical companies, robots of hospitals, robots of insurance companies, and they pretty much function as if like they were programmed to do certain things. When I practice lifestyle medicine, I almost feel like I'm talking to a friend about like, what are we going to eat tonight? I mean, it's almost like a different holistic feeling, much more than just being a robot as a doctor.
Yeah, absolutely. It's I think what we see in the patient population is the ones who are willing to open that door are pretty quick to pass through, because I don't hear anybody saying, I tried it for a while and I went back. It's just because there are so many of the benefits that you raise up.
I think I agree with you. Like Dean Ornish says that Dean Ornish is a physician from California who is considered a father of lifestyle medicine. He says that when a patient starts practicing good lifestyle, they actually start to feel so much better in 3 to 6 weeks. They almost get addicted to it. Their sleep improves, their mood improves, their sex life improves, their overall productivity improves. They become better father, better husband, better worker, and they almost feel like, why I did not do it before? But unfortunately, many physicians are not making this happen to the patients. I think once patient gets hooked to it, they will surprise the healthcare system that they can take the charge.
Yeah, it's okay. So let's come back to it a little bit in a minute. But one of the things I'd like to drill into a little bit is just to kind of maybe the catch-all when we talk about cardiovascular disease. Maybe just touch on kind of maybe the top ones that are the real ones of concern, and then marry those up with the things that lifestyle medicine can help with. So if we start like with coronary artery disease, for example,
Yeah.
is the one that's most popular, and kind of
Yeah,
and then kind of work your way down a little bit, just because they're not all the same disease, right? Even though we put them in the same bucket.
Yes, I agree with you. I think heart disease obviously is a big part itself, but coronary artery disease, or the blockage in the arteries of the heart, is the most common killer in America. Matter of fact, just to give you some perspective, today in America, about 1,500 people will die from heart attack or heart disease, from the coronary disease, 1,500, versus corona will have probably 100 people die from corona. So heart disease is extremely large number of people die every day. Corona is very critical, very important. We need to take care of it, and we will do fine. But heart disease, even though for last 80 years, the numbers have keep going up, we are not taking heart disease or heart attacks as an emergency. We took corona as an emergency, but we are not taking coronary disease or heart disease, heart blockage as an emergency. And that needs to change. For example, African Americans almost have 20 to 30% higher chance of having heart attack and heart disease age by age. They get much earlier heart disease, heart blockage, heart attack. They get much earlier diabetes. They get much earlier high blood pressure. So heart disease is number one killer. And that's where I think the most bang can happen if you make lifestyle changes. Heart disease, when we talk about it, typically it means heart blockage, actually. So coronary arteries, which are the arteries on the surface of the heart, they supply the blood flow and nutrients and oxygen to each muscle cell of the heart. When a blockage happens in those arteries, that supply of nutrients and oxygen is hampered, and muscles start suffering from lack of oxygen, lack of nutrients. And person starts having chest pain, particularly on exertion. So for our viewers, if someone is having chest pain on exertion, or radiating to their left arm, or they're having shortness of breath on exertion, or they're feeling unexplained fatigue, that could be a sign of heart blockage. Please reach out to your primary care physician or your cardiologist, because it's very critical. If you're having similar symptoms like chest pain radiating to your arm, sweaty feeling, unexplained fatigue, shortness of breath at rest, like if you are sitting, if you're on a couch, if you're in a bed, and if it happens at rest, that's an emergency, because that could be a sign of heart attack. You have to call 911, because once a heart attack starts happening, time is critical. The longer you stay home while heart attack is happening, much higher chance of dying. Matter of fact, even today, 10% of people with heart attack will die on the spot. And that's because of, we call ventricular fibrillation or cardiac arrest or sudden cardiac death. So prevention of heart attack is very critical. Recognizing the heart attack has started, whether you are home, wherever you are, is extremely critical. Calling 911 is very critical. Please take the heart disease, heart blockage very seriously.
Yeah, thank you. The and maybe just talk a little bit about kind of what happens. This was a relatively recent learning for me. Is people assume it's like we think of the drain pipe, that it gets the blockage and it just slowly accumulates, and eventually it's totally blocked. If we look at the drain pipes in our house, for example, but in heart disease, things typically happen a little bit different, is what I understand, right? So maybe you can kind of, because that's what we expect to happen, but then suddenly you have the emergency. Maybe you can explain what's happening there.
Yes, I think that's an excellent question and comment you made. For example, if you look at your water pipes at home, when the blockage in the water pipes at home is 20, 30, 50%, typically your water flow would be fine because blockage is very minimum. But when you look at the arteries of the heart, that's actually not the case. When the blockage is between 20 and 70%, those plaques are as, if not more lethal and more troublemaker than a blockage which are above 70%, because a 50% blockage will not hamper the flow, will not cause chest pain when you are exerting. So you may escape a negative stress test, and then a 50% plaque buildup can rupture, can crack, and over there a small clot can form, and that clot can mushroom and then block the whole lumen or whole opening in the artery, and that can totally stop the blood flow so instantly that heart starts suffering instant lack of oxygen, lack of nutrients, and that's a heart attack. So I agree with you. I think in our house, when water pipes are blocked 50%, many times we can go on for 20, 30 years. But when arteries of the heart, when the blockage is 50%, that could be as lethal as blockage of 80%. So we have to take it, every blockage, very seriously. And matter of fact, we know now from Korean soldiers dying in war, or people, unfortunately, who died in a car accident at a very young age, like between 15 and 25. And when autopsies were performed on those people, matter of fact, we started seeing cholesterol deposits or fatty streaks, we call it, or minor blockage coming in between age 15 and 25. So blockage starts very early, around age 20. So prevention has to start very young. So I tell my patients that not only do it for yourself, but do it for your kids, and for many of them, do it for your grandkids. Because if I see a 7-year-old person, their grandkid could be 20-year-old, and that 20-year-old already has started some mild blockage in their life. So I think prevention has to start very early in all of us. Many of us are actually already behind. So we need to be acting very cautiously, very fast to reverse the plaque buildup we have. For example, when I did we will talk about it later on. When I did my calcium scoring, which we'll talk about it, my score came back slightly high. And that was because of last 30 years of practicing cardiology, taking a lot of calls, not having a perfect healthy lifestyle. So I already have some plaque buildup. Now I'm going to reverse it. I already have worked on it, and I'm going to make my calcium score stable. So point is, like you said, heart blockage anywhere from 20% to 100%, they all are important.
Yeah, and I think you hit on another really important point there, is that we tend to associate heart disease with the elderly. And in reality, it's way too late, right? At that point, like everything else, we have very limited, or certainly fewer options. You're not going to like the options that are available at that point. And so another point I think is important for people to understand is what's changed around how we treat heart disease now. So blockages, and so specifically, I'm talking here about stents and angiograms.
Yes.
Can you take us through kind of what was the norm versus what's now the norm when we have kind of advanced cardiologists like yourself that have more tools in the toolbox of kind of why that's changing now?
Yes, I agree. So I think when you look at the heart blockage, even though we employ the lifestyle changes, some of those blockages have progressed enough and advanced enough. And some of those blockages will, like we said, crack or break the plaque and make a clot, and emergency can start. And that's where the heart attack can start. So I think even though lifestyle changes are paramount and very important to do, unfortunately, some people will still require some of the advanced cardiology. So we need both advanced cardiology practice as well as lifestyle practice. So when I see a patient, if I see a patient who's having chest pain, for example, I'm going to walk you through a scenario how I would see a patient in my practice. So if I'm seeing a person with chest pain, my first question would be, are you having chest pain on exertion? If that chest pain is on exertion, and if it's rapidly building up, they're getting chest pain every day on exertion, and many times even getting at a minimum exertion, almost no exertion, that to me is a medical emergency. I need to send them for what we call coronary angiogram, commonly we call cardiac catheterization, where a person would come to the hospital, cardiologist would put a small catheter through a small opening in the radial artery typically, which is the artery in your wrist, and then travel up to the heart with a small catheter, inject the dye, and take the pictures of the coronary arteries or the arteries of the heart. And if there is a blockage, it will light up on the X-ray, and you can see there is a blockage. If there is a blockage, the options include putting a stent, which is a small mesh or small spring type device, which has been around actually now for about 30 years. So stents have been around 30 years. Stents have advanced now. We have now drug-eluting stents, we have self-absorbing stents. So stent technology is very much advanced now. Stent takes about 20-30 minutes to do it. The whole procedure, including coronary angiogram or catheterization, and stent can be wrapped up in 30 to 40 minutes. So this is the most current state of how we treat the heart blockage. In the past, when I came to this country, stents were new actually. Stents were only 2-3 years around. And the most common way treating a blockage was either with medications or with bypass surgery. And many times when the blockages were advanced enough, when blockages were in multiple vessels, multiple arteries, bypass surgery was the only option. Bypass surgery was one of the most common operations 30 years ago. Very expensive operation, matter of fact. Bypass surgery today costs about $60,000. That could be a lot of people's, mortgage, 1 year, 2 year mortgage, could be an expensive car. So bypass surgery is very, very expensive. Stents are expensive also, but much less. The recovery from stent typically is 48 hours. You can actually go to work in 3 to 5 days, while bypass typically is about a month or so. So I think bypass surgery was very much of a invasive procedure. Stent is much less invasive, still invasive, but much less invasive. And stent has become now the gold standard of treatment. Particularly if somebody's having acute or urgent heart attack, stent is the way to go. Now, cardiologists can put a stent in a person having acute heart attack, open up the vessel, restore the blood flow, and abort the heart attack and salvage or save the muscle loss. And that's the reason a lot of people now with heart attack are surviving longer, because the net muscle loss from a heart attack has gone much more down. Now, actually, if a patient comes to my emergency room, and if we see the sign on the EKG that they're having heart attack, they're instantly taken to the cath lab, and now we have a time limit of 1 hour. Within 1 hour, the blockage, the clot, the stent has put in, and muscle is salvaged. So stent has become a gold standard now.
Yeah, that's great. And but I guess, but that's really at the last or at the 11th hour, right? When they're already in an acute condition.
Yes.
So where you've got some time to work, and who really wants to be in that situation, right? It's that no one wants to wait to that, because as slick as you make it sound, in reality, you probably have a number of other conditions that have been building up at the same time.
Yes,
right.
I agree with you. I think, for example, there are 2 trials now. Both trials have proven that even if you have blockages, as long as you are not having heart attack and you are just having exertional symptoms, if you employ lifestyle changes, which includes eating healthy, exercising 30 minutes a day, meditation, not smoking, taking your medication, including cholesterol medicine, and follow them versus put a stent and follow them, both group 2 as equal, as long as they are not having heart attack type symptoms. So I agree with you. I think if you are not into that really, really major emergency, I always offer my patients that your symptoms are not an emergency. We still can take a lifestyle route, and actually data will back me up that it's okay to take a lifestyle route, medication route, instead of going directly to the stent. Unfortunately, many cardiologists, many interventional cardiologists, whenever they see a blockage, they want to put a stent. And that's been proven now that that's actually a wrong practice. Not all blockages require stent. Matter of fact, you can reverse many of the blockages with lifestyle medicine. So I agree with you. Stents are overused in this country. Stent use could be easily 50% less than what truly is used right now.
Yeah, and I guess if you're being fiscally responsible with your own money, it's not the cheap alternative either. It may cost less than bypass, but compared to lifestyle choices, which costs essentially nothing, other than some time and education.
Yeah, stent would cost about $15,000 to $20,000, and obviously, still as an invasive procedure, you take a risk of a small stroke, kidney damage, even a very, very small risk of death. So they're not only cheap, but they're also risky procedures. And I think, like you said, lifestyle changes are very inexpensive. Plus it makes you like when we put a stent in somebody's heart, the sleep typically doesn't improve. While if you start having lifestyle changes, exercise, meditation, healthy eating, sleep improves, your mood improves, your productivity improves. So it's just so much more you achieve, more than just a heart disease with lifestyle changes.
So, so just to kind of wrap up on some of the medical side of it, so some of the test procedures that people can get done to get some self-assessment done, whether they've been to a cardiologist or not, if someone wants to learn more about their current heart health, what would be the sort of tests you'd suggest they look at having done?
So, unfortunately, right now, if you want to do any heart test, the real diagnostic heart test, you require a primary care physician or a cardiologist to perform that test. And the most common test is the stress test. And as long as you are having symptoms like chest pain, shortness of breath, fatigue, your insurance company typically will cover the stress test. And if you don't have insurance, you can go to many centers where they can actually perform, we call a plain stress test. We'll talk about it in about $100 to $150. So they're not very expensive. And stress test is still a gold standard to diagnose heart blockage. Stress test is the one where a person comes in, we put them on a treadmill, we connect them to 12 leads or 12 wires, and then we make them walk. And if we see changes on the electrocardiogram through those 12 leads or 12 wires, then we know the person has blockage. And that's an easy way to do it, very cost-effective, very good test, been around for 100 years. The second thing sometimes we do is when somebody's having an abnormal EKG, then we add pictures with the walking, not just the EKG, but pictures. And those pictures can be in the form of either echocardiogram or a nuclear imaging. And those are very slightly more expensive, very diagnostic, almost 95% accurate. That, for example, stress echocardiogram, where we take ultrasound pictures, is about $300 to $400. And if you do an exercise with the nuclear pictures, it's about $900 to $1,100. So slightly more expensive than a plain stress test. But those are the three tests we do. If a person cannot walk because either they have a bad knee, or if they had a stroke, unfortunately, or if they had a stroke, or if they have a bad lung disease, or whatever reason they cannot walk, then we do a chemical stress test where we bring them in, we give them a medicine to essentially stress the heart, and then we take the pictures of the heart. And that test is very accurate too, cost about $800, $900 also. So there are very good tests available, very accurate, very cost effective. So if you have risk factors and if you're having any symptoms, make sure you reach out to the doctor. There are some other tests which you can actually take it as a surrogate test for the blockage, where you may or may not need doctor's prescription. For example, test called calcium scoring of the coronary arteries, where we essentially look at the calcium in the plaques in the arteries of the heart. And we take a very split second CAT scan, like 30-second CAT scan of your heart, and then calculate how much calcium you have in your coronary arteries. And to give you some perspective, 400 score, for example, is a very high score. Anybody who score over 400, that means they may have some serious blockage. A score about 1,000 means you definitely have many serious blockages. So calcium scoring, which only costs $70 to $120, many times you don't even need a prescription. Many hospitals will just do it as a walk-in scheduled procedure. So that way calcium scoring can be done. There's another test called CAT scan with a dye, which may require a prescription from a doctor, where you come in as they put a small IV, just a very small IV, and they give you a dye and then take a CAT scan of your heart. And that test actually is very accurate, very good. Typically, it can be a reasonable alternative to coronary angiogram or cardiac catheterization, much cheaper, much more less invasive, and very accurate. So typically, when I see a young person, for example, 25, 30-year-old, where suspicion is very low, but not zero, I many times will order a CAT scan with dye to rule out a heart blockage. On the other hand, if I'm suspecting a heart blockage, more than 80-90%, then I definitely refer them to coronary angiogram or cardiac catheterization. So all these tests obviously are very important. Matter of fact, I should also mention about there's a company in America called Lifeline Screening, which many of you have heard about it, our viewers must have heard about it, where they charge you like $100 or $150, and they do 3 or 4 different tests. One of them is EKG, which is important because as we get older, EKG abnormality starts to happen. For example, atrial fibrillation, which we'll talk about it, atrial fibrillation, which is irregular heartbeat, can be very asymptomatic, like without symptoms, and EKG can pick it up. They will also do a carotid ultrasound, which is the artery in the neck, which sends the blood to the brain. That artery, they will look at it also. They will also screen you for aneurysm in the belly called aortic aneurysm. And they will also screen you for any peripheral arterial disease or PAD or blockage in the leg arteries. And they wrap up all the procedures in $150, even though sometimes I don't want people to get scared and people to get fear, but in a person who is very balanced minded, this kind of screening procedures and active objectively is nothing wrong. Matter of fact, many times I told my friends and family that get that Lifeline test done, which is only $150 for 4 tests.
Yeah, it's I think people who are shy about going to the doctor, they find reasons to, but my background is engineering. And so I'm just trained to make decisions based on the data, regardless of whatever my emotional attachment might be, or, my fear of pain, or if I enjoyed pain or something. So, generally knowing is always better because you're going to have more options, right? More time, more options. And it's becoming more and more available to us. How about in terms of blood work? Because that's an area where I see people, the primary care physician aren't maybe always asking for as much information as they might, but that's clearly something at this point we should be looking at regular intervals, right?
Yeah, definitely. I think the most common test, which in my opinion should be done much more often than we do it, is the cholesterol profile, lipid profile. I think, for example, anybody after age 20 should have lipid profile done. Matter of fact, the newer pediatric recommendations are that they should have one-time lipid profile done after age 5, just one time to make sure they don't have familial hypercholesteremia. But after age 20, they should have cholesterol profile done right away. And if the cholesterol is high, lifestyle changes, healthy eating, exercise should be employed. And if that doesn't bring the cholesterol down, then we sometimes use medicine called statin. Statin obviously is very safe medicine. It's been around for almost 35 years, very cost effective. Some pharmacies actually give out the statin free. So statin has been very good godsend medicine, in my opinion. I think because of statin, a lot of the heart disease have actually been stabilized. So I think statin is a good medicine. The next blood test, I sometimes definitely ask patients to do is we call HSCRP or CRP. Because we know now that chronic inflammation has been proven now to cause heart disease, heart blockage, Alzheimer's disease, even diabetes, even increasing your visceral fat, many other conditions. So chronic inflammation is just not good. And this HSCRP, C-reactive protein, high-sensitive C-reactive protein, HSCRP, picks up the chronic inflammation. And typically, you should keep your level below 1. HSCRP costs about $25, $30. Lipid profile, the cholesterol profile costs about $20. So both tests can be wrapped up in what, $45, $50. The other test, sometimes we don't do it commonly, but I think we could in a certain population, is called lipoprotein A. Lipoprotein A is another type of lipid or a cholesterol, which actually makes you more prone to have plaque rupture, inability to dissolve the clot, and can cause the heart attack. So lipoprotein A is another test, slightly more expensive, about $70, $80. But if you are Asian, if you are Indian, the lipoprotein A may be a reasonable test to do. But I think if you have strong family history of premature coronary disease, like a male before 45, female before 55, then ordering a lipoprotein A is a reasonable thing to do. The other test, which many times as a cardiologist in the past, and many other cardiologists, many people typically don't look into is the A1C and blood sugar, because we know now that diabetes actually is a heart blockage equivalent. So if somebody has diabetes, they're going to behave as if they already had one heart attack. So I think looking for looking for subclinical signs of high sugar or diabetes is very important, because many times a borderline diabetes or pre-diabetes can be silent and not have any symptoms. So just checking a simple sugar. If your sugar is above 100, you're pre-diabetes. If the sugar is above 126, you're diabetes. Same way, if you look at the A1C, above 5.7 is pre-diabetes, above 6.5 is diabetes. So those are some of the common lab tests I would order. Sometimes I also order like vitamin D level, B12 level. For example, if you are vegan, definitely B12 deficiency is very much of a big issue, and B12 can lead to many times, B12 deficiency can many times lead to high levels of homocysteine, which also can promote a heart blockage. It also can cause Alzheimer's disease. So sometimes I order B12 level. For example, recently I saw an Indian patient actually, and realized that being a vegan person, vitamin B12 could be playing a role. I ordered her vitamin B12 level. It came back only 112. The lab normal is 300. I keep my B12 about 700 to 800. And I recommend everybody to keep their B12 above 500. So her was 110. So B12 deficiency is a real thing, particularly in vegan. Even in some vegetarian and non-vegan people, B12 deficiency is very, very common. So I recommend B12 actually to all vegans, regardless of the levels.
Yeah, that's good. And because B12 is dropping out of a lot of treated water that we used to get as well, right? So I think most of it says now it doesn't even matter if you're vegan. It matters more, perhaps, but to assume you're getting it through other sources, that's really not the case anymore, is it? And I just keep hearing more good news about vitamin D. I was reading something else this morning about vitamin D as one of those cornerstones to all sorts of healthy benefits.
Yeah, it's like a hormone. It's more than a vitamin. It's just a hormone.
Yeah. So can we talk a little bit about, I'll probably I can probably throw up some visuals to put on this, but if we think about that blockage in the artery in terms of the different ways that that cholesterol can build up or the deposits can build up, the obvious way is where we see the constriction, which I think I'll put a photo up to show people what that is. Yes. But there's also other ways it can deposit as well, right? In terms of within the walls, in the endothelial cells. Can you talk a little bit about the older deposit isn't always just a deposit? That's why you need to get experts involved.
Yes. So actually, matter of fact, when the early deposit starts happening, it typically happens towards more of an outer wall of the artery. As a matter of fact, arterial remodeling happens to maintain the flow, and the lumen or the opening maintains. And actually, paradoxically, lumen many times actually gets slightly bigger. I think it's called Vercoe's hypothesis, where in the early stage, matter of fact, most of the deposits are in the outer side, not encroaching upon the lumen. It's a mid to late stage when the plaques start to encroaching upon the lumen itself. The other thing is, many times when the plaque is minimal, we call endothelial dysfunction, which means like when we exercise, when we are under stress, when we take shower, our arteries in the body have ability to dilate and send more blood to the area where it needs. And that dilation happens because of endothelial function, the nitrous oxide. And many times, before even the cholesterol and other fatty streaks starts happening, persons start to have endothelial dysfunction. And that's a mainstay right now of going plant-based, going lifestyle, going holistic, because you will reverse your plaque maybe in 6 months to a year or 2 years, but you can reverse actually your endothelial dysfunction. You can restore the nitrous oxide supply, and you can restore that endothelial function to dilate or open up your vessels more very quickly, in few days actually. Matter of fact, there were some studies done where people were given fatty meal, and in 3 to 4 hours, their endothelial function was down in 3 to 4 hours. So this is a very dynamic thing. It's just not a static plaque where we just see a encroaching on the lumen or the opening, but this is a very dynamic process. And I think people don't realize that heart attack and heart disease is a very ongoing second to second method, a second to second process, and we have to work on it second to second. I think every meal you eat, every unhealthy fatty meal you eat, exposes you to that plaque rupture, endothelial dysfunction, and matter of fact, set you up for an instant heart attack. So when you said that this is my only burger today, that burger can be your last burger.
Yeah, yeah. It's also in my experience, the body does a great job of adapting to all sorts of diets, right? It's got limits of how much it'll absorb, even of the worst diet. But that doesn't mean it's okay, because as your diet gets cleaner, unfortunately, the occasional burger has a worse impact than if you ate it every day.
Yeah,
So,
I think that's a good point. Another analogy is that many times a person who never exercises and suddenly when the snow comes, starts shoveling the snow, that's when the plaque rupture happens because they are not accustomed to that exercise. Same way, if you're eating healthy and then if you have sudden load of this fatty meal of the burger, that's when the plaque can get unstable. I agree with you, yes.
yeah, the shoveling snow is a good analogy for those who live in Michigan in particular.
Yes, yes, yes.
Hopefully, you've had a reasonable winter. I know in
This,
the
this time,
Mid-Atlantic area, it's the winter that never came. But
yeah.
um, the so maybe can you talk a little bit about we talked about it earlier and kind of come back to it now in terms of lifestyle medicine from a training standpoint. So I hear this. I interviewed a young primary care physician just last week, and who said still no training in med school around nutrition. So, but got that all through lifestyle medicine. So as a cardiologist going through that, can you kind of give us a sense of this whole other training that you've got and what that really means? Obviously, I think at this point, every cardiologist should somehow find a way to make it happen.
Yes,
But, but it's not something that you spend a few hours reading on the internet. Can you kind of give us a sense of that whole side of it?
I'll be very proud and very honored to walk you through what I went through for the last 3 years. 3 years back, I got connected to Dr. Joe Furman. You know, he's another, I almost call him the father of nutrition in a way, but he himself follows his own method. He has written multiple books. So I got hold of his PBS documentary on healthy eating. So I started my journey with that. Then I came across American College of Lifestyle Medicine, which is a new college for last only about 5 or 10 years. And the board certification in lifestyle medicine has only happened for 3 years. Matter of fact, when I took my lifestyle medicine boards, I was the second year. There's only one time it had happened before. And the first year, about 300 people took the lifestyle boards, 300. Second year, about 450 people in the whole country. And I'll give you some comparison in a second. So 450 people took lifestyle boards. There were only 2 cardiologists out of 450. 2 cardiologists. And to be honest with you, that number hasn't changed much. So cardiologists need to catch up a lot. Last year was the third year, and about 600 people took. So percentage-wise, it's growing exponentially, but not fast enough. And lifestyle medicine, actually, and to give you some bragging rights for me, I scored second out of 450 of all people who took the boards. I scored second out of 450 because I have taken this thing to the heart. I have read so much, Scott. I have read almost 200 books because I personally feel that even when I read a book, which is more public-oriented book, there's so many golden nuggets to grab from because that language is much more palatable than reading a dry language of a medical book. So I actually read so many journal public book on lifestyle, healthy eating, exercise, sleep, that I've become a better speaker because I can understand what other authors are trying to convey to the general public. So I've become a better person to explain what happens with lifestyle changes. So lifestyle changes, in my opinion, there are 6 things we learn in our college, in our lifestyle medicine school, that most important pillar is the nutrition. Nutrition pillar is almost 70 to 80% of all the lifestyle changes. The weight of nutrition is just so much because nutrition plays such a large role. The second pillar is exercise or physical activity. Third pillar is sleep because many times we take sleep as a granted. Many times when we take sleep as a waste of time, but we have now realized that sleep actually is probably as important as exercise, as important as almost as important as eating. So we learn a lot of things about sleep. The fourth thing was substance abuse or alcohol, many other drugs, because that also plays a role in lifestyle medicine. The fifth thing was stress management, because a healthy mind leads to a healthy body. So we got big emphasis on stress management. And the last thing was a relationship, because when you have a good relationship with your spouse, with your partner, with your family, with your parents, with your friends, with your churchgoers, with your fellow goers, with your workplace, you almost become more healthy, because those healthy habits actually start to permeate into a whole group instead of just yourself. Plus, doing any activity, including lifestyle activity, healthy lifestyle activity in a group is more fun. So we actually got a exposure to all the 6 pillars, all the 6 disciplines. But the thing which I learned most as my journey, that most physicians are good scientists, but they're very lousy coach, because they can write a lipid tour or cholesterol medicine in 1 second, but they are not able to coach how to eat healthy or how to exercise. So we got actually exposed in our lifestyle medicine, board review course, online lectures, conferences, almost 20 to 30% emphasis on coaching, because to me, I'm a better coach now than ever before. And coaching applies not just into lifestyle medicine. Now I'm a better husband, better father, better friend, because now I can coach people a lot better since I've taken lifestyle medicine. So I actually highly recommend all cardiologists to go through lifestyle. Any physician, either MD or DO, can take a lifestyle medicine board certification. Even though it's very detailed, very complex, passing rate is very high, and you'll be certified in 3 to 6 months of preparation or training. All cardiologists should go through that. They will have such a high respect for the lifestyle changes, what it can do to the heart disease. And I think if we do that, my feeling is the specialty is growing, but not growing fast enough. And people like you and me, if we ask our viewers to start asking their physicians that, can you get certified in lifestyle medicine? I think the movement has to start at grassroots. I think patients have to ask their physician that how much nutrition training you had, or are you certified into lifestyle medicine? I think physicians themselves probably will be a slow riser. They will not do it as quickly as you and I want. But if the movement comes either from people or from insurance companies or from Medicare, that lifestyle is a part of your curriculum. Because matter of fact, now we are thinking that American College of Lifestyle Medicine is actually going to talk to even the examiners for the USMLE, which is the exam for the medical residents, that we are starting to incorporate some questions in their boards about lifestyle practices. Because when it's going to be an exam for the USMLE or boards, obviously medical schools are going to start putting into their curriculum, because obviously every medical school wants their students to do better in those exams. So I think once we get, I think all this, just like I was another podcast, this drug companies, this food companies, they have scientists, they have PhDs to how to maneuver, how to change people's mind, people's habits. I think we need to be equally smart, equally diplomatic in changing people's behavior, changing physicians' behavior. If we go with a harsh approach, it's not going to work. If you're going to go with a very soft approach, it's not going to work. We have to balance how to make physicians get board certified in lifestyle medicine, how people start doing lifestyle changes, and all those things going to require a lot of people like you and me to broadcast this thing pretty much every day. And that's a reason on our Facebook page, I post 3 to 4 times a day, matter of fact.
Yeah, it's and that's really if I look at what's our mission with Longevity Advantage, and with the teaching I do in the classroom, it's the same. Number one goal is help people ask better questions.
Yes.
I can't possibly teach you all the things that I would like you to know, because I don't even know them all myself yet.
Yes.
But if I can just get you asking better questions, you're naturally going to get more curious, and you're going to challenge your physician or whoever it is that you're in care to, that you care about. You're taking personal responsibility, and and you're not just going to follow through. And because in my experience, many physicians, if you show a committed interest in terms of you spent time on understanding your health, they are
Yes.
more interested to engage in a deeper conversation with you if
That,
you've taken the
that
time and trouble. Right?
That's an excellent observation because when I give my lectures on lifestyle, I have two slides on how to get best out of your primary care physician. Because when you go to primary care physicians with questions, with curiosity, not only they interact with you better, they spend more time with you. If you take notes, they actually explain you more. If you show the interest, if you show the commitment, they actually almost become doctor themselves. I think, to be honest with you, I always used to say that even your mom doesn't give you anything unless you ask. Same way primary care physician, they're not going to. So you have to take the charge because at the end of the day, it's your life, it's your body. You might as well take the charge.
Yeah, well, and some of the information you've put in there, I was going to circle back to it anyway, was one of the things we're putting together is a dashboard to try to provide for people across holistically, what would be the metrics that you should know yourself? Like, so you should know what's your total cholesterol, right? And if you
Yes.
don't know, that says something right there. What's your LDL? Well, again, and if you'll understand your risk factor, and that the other benefit of that is it now gives you a score to try
Yeah.
to measure yourself and get some
Yeah.
improvement, because we can all, like, you can lose weight and say, well, I'm feeling better, but unless you're on a losing weight through a diet that's sustainable to ultimately better health, that's just going to be the yo-yo thing,
Yes.
right?
Yes.
And everything about lifestyle medicine and whole food plant-based, it's not a diet, it's truly the diet. What diet truly means is what you eat. It's not
Yes.
about weight loss, and
Weight
that
loss.
just is a
I
natural
think
outcome anyway.
when I give lectures to people, I tell them that there are various ways of losing weight. If you start smoking, you will lose weight, but that's not healthy. If you go on a chemotherapy, you will lose weight, but that's not healthy. If you get depressed, you will lose weight, but that's not healthy. If you go on a starvation diet, you will lose weight, but that's not healthy. If you go on a keto diet, just to tell you what you were just saying, if you go on a keto diet, you will lose weight short term, but that's not healthy because keto diet will jack up your LDL, expose you to heart disease, heart plaque ruptures, and it actually will kill you more. So keto diet is another fad diet. So I think the best way to do is just the whole composite nutrition chain, not just, I agree with you, diet word, in my opinion, is just a wrong word. I think it has to be a more of a nutrition change where we look at the whole plate, not just like, and again, the macro ratio has been very popularized now, but in my opinion, if you look at the T. Colin Campbell, he says that follow whole. And he has written a whole book on called Whole, where if you eat whole food plant-based diet, you don't have to look at the ideal macro ratio because God is great. Nature has done such a good job that if you eat whole food plant-based diet, you will get appropriate amount of protein, fat, and carb. And to give you some macro example, keto has a carb less than 10 to 15%, many times less than 5%. If you look at the blue zones, where people live long, healthy, and happy, their carb is almost 70 to 80%. So I think keto diet is exactly opposite of people who have lived long. So I think if you want to look at the macro ratio, look at the whole food plant-based diet. Same thing, because it will give you an ideal ratio. Same thing applies to calorie counting. There are a lot of apps on iPhone, Android to count the calories. Even when we had a personal trainer, he would say, count your calories. Our son was even saying, the weigh your food and see how much calorie you are getting. But to be honest with you, you do it for a week and then you get tired, you get bored, you stop doing it. The best way to do is just eat whole food, plant-based, and if you can, minimal or no oil diet, no dairy, no animal products, you will never need to count the calories because all that food, whole food, plant-based diet gives you so much fiber, it gives you satiety, and you will stop eating when you are done needing your calories. You will automatically gravitate towards your ideal body weight. Matter of fact, Dr. Furman says that if you eat whole food, plant-based, no oil diet, you will not only start losing weight, you will get to the weight where your body should be ideally. You don't have to count the calories. You never have to even get up on the scale if you don't want to. Just eat whole food, plant-based, no oil diet.
Yep, it's a living example here. I enjoy numbers, but it was even when I made the change, didn't make any other. I was exercising before, exercising after, and it was just immediately,
Yeah,
some pounds they just disappeared.
disappear.
Yeah. Um, so just kind of know we're respecting time here. So for people around the country or even outside the country, if they're looking for some help locally in their own community, particularly to work with a cardiologist, perhaps, can you suggest where they might start?
So, for example, if you look at the American College of Lifestyle Medicine, there's a whole directory maintained online, and you can look up a physician in your area who's certified into lifestyle medicine. If you look at the cardiology, obviously you always go for a board certified cardiologist. If you are starting to gravitate towards lifestyle changes, lifestyle medicine, on the first day with a cardiologist, ask like how much he or she believes in lifestyle changes. And I think, to be honest with you, I used to take it very personally when a patient changed my practice. Now I feel like some patients just don't match with me. Same way, if you see a cardiologist, if you feel like his or her philosophy is more of a pushing pills and procedures, and if your philosophy is more lifestyle changes, nothing wrong changing. I think you may find on your second or third trial, a cardiologist who wants to work with you, who wants to follow your mission of lifestyle changes, want to spend the time with you, and actually congratulate you when you advance into lifestyle. That's a cardiologist I would look for. And if you look for American College of Cardiology and their online website, you can find a cardiologist who has interest into lifestyle medicine. Same with primary care. I think many primary care are very holistic. I respect them. I actually, matter of fact, love them. When I get a patient from a holistic primary care physician, my respect is much more higher because those patients have been so well taken care of that they're not overweight, they typically don't have diabetes. They're actually a living example of what Americans should be. So I agree with you. I think reaching out, plus I offer my service also. I typically answer all simple questions. Obviously, I'm not going to practice medicine over the phone or over internet, but at the same time, if somebody has a simple question about the diet or exercise or sleep, or any specific cardiac questions, I don't mind answering them informally without taking any kind of responsibility, just guiding them through. Because we all have enough free time in a day if you manage your time wise. And if I get 3-4 questions a day, I don't mind answering them. So all the viewers, if there are some burning questions, just send me an email or send me a thing on my Facebook page, and I typically respond to people within 24 hours.
You are one of, if not the most generous physician that I know. And so this is not lip service, folks. This is this is a man who follows through with what he says. The other thing I just might add would be in terms of the Ornish program, looking if there's an Ornish program in your community. In all likelihood, the cardiologist attached to that is going to be a lifestyle medicine trained cardiologist, right?
So, point. Matter of fact, Ornish was able to approve his program through Medicare. So now, actually, if you have a heart blockage, if a person already had a stent or a bypass, they can actually enroll into Ornish program, and Medicare will pay for it. So I think Ornish is another great way to start with your cardiologist.
Yeah, it's clearly this whole area is just it's moving so quickly and really moving in the right direction. That's I'm excited, and for you to be at the leading edge in cardiology, I think I always let's have the conversation again in 5 years, and
yes.
There's there'll still be unfinished work to do, right?
Yeah,
no question about that. So, well, thank you very much, Aajay. This has just been a wonderful talk. I love your spirit, your positivity that comes through, and I think that comes through as well because, like, we're talking about the #1 disease in the country, and it's in terms that kills people, and it's the one that we can impact the most. Right?
Yes.
Like no one has to sit back and be a victim here. This is something you can start to take control of, and it's really simple. Just look for whole food, plant-based.
Yes.
You don't have to put any other label. It's got lots of things fit in there. And it'll change your life in so many ways. And
so many
have the specialist here telling you that absolutely this is the thing to do. Like this really is true. And to have you as part of our family,
Thank you.
Ajay,
Thank
I'm
you.
just so grateful, and thank you
Thank you.
for
No, thanks
sharing
for having
you
me.
with us.
And like I said, I think person like you who comes from different discipline and totally dives into it more than many physicians I know. So I commend you also. I think you have taken this as a life mission. I think I see your posts, I see your interviews, and I think this is your calling, because this is not your main job. This is not what you went to school for, but you've taken up this as a new hobby, new calling, and I think whole America will benefit from it.
This is from hanging out with physicians for too many years. I'm more comfortable with doctors than I am with engineers sometimes. So no,
Yeah.
it's a very welcome and particularly a progressive community that we're part of here. And I'm, anything I can, 'cause what I try to do is offer a perspective. I try to. No one wants to believe it until we can encircle them with the same information from a number of perspectives. And when everyone's saying, really, that's the good thing to do, people are more likely to believe it. And that's really what I'm trying to do from where I'm coming from. So no, I really appreciate it. Well, thank you so much,
Right.
Ajay, and best luck, and we will talk again.
Definitely. Thank you so much.
Okay.
Thank you.
Thank you.